The latest official evidence of the human cost of coronavirus shows a very sharp rise in the number of deaths per week throughout England and Wales, 6,000 more than would be expected at this time of year. The figures released by the ONS, that's the Office for National Statistics, relate to the week leading up to the 3rd of April, since when the numbers have risen again, and there is particular concern about the situation in care homes and in the community at large. Now, the new figures show that more than 1 in 5 deaths in England and Wales are now linked to coronavirus. Across the UK, there were 778 deaths reported in the last 24-hour period, most of those in hospitals. And it means that so far, the official number of deaths in the UK linked to coronavirus is more than 12,000. But it's important to note that that number doesn't include deaths in care homes or in the community in England or in Northern Ireland. Now, the impact of the crisis on the economy is also causing concern. An independent report says that a 3-month lockdown could cause the economy to shrink by as much as 13% this year. More on the economy in a moment, but first, our health editor Huw on the latest figures.
My mum, she was my best friend. She was kind, funny.
Candice remembers her mother Anne, who died with COVID-19. She last saw Anne when she was in an ambulance on the way to hospital, where she died 11 days ago.
I'm never going to see my mum again, and I'd rather not see the outside again than never spend my mum was only 58 and it just wasn't her time. This is just the worst pain in the world, and I just think it's just not worth it. It's just not going outside and meeting up with your friends.
A tragic loss, and there are many others suffered by families every day. And now new statistics reveal there are more than we thought. Until very recently, all the focus on coronavirus deaths has been on those in hospitals. That's where the daily data comes from. But the latest set of stats shines some light on the spread of the virus in local communities and deaths there which might be directly or indirectly linked to COVID-19. Weekly deaths in England and Wales were at the highest since records began in 2005, according to the Office for National Statistics. In the week ending April the 3rd, there were more than 16,300 deaths. That's around 6,000 more than the average for this time of year. Coronavirus cases contributed much of the jump, linked to nearly 3,500. But it's not clear what's behind the rest. Possibly some could be caused by people not seeking treatment for other conditions.
It is possible that there are further deaths that relate to coronavirus that haven't been recorded as that. It is possible that there are further deaths that relate to other conditions for which people perhaps have not accessed help in the way that they might have done in the past.
The head of NHS England, after a big drop in A&E visits last month, has urged patients not to stay away from hospitals.
If you're a parent and you're worried about your child, if you're concerned about maybe having a heart attack or a stroke, any other essential need, please come forward, access the NHS. Our staff are here to look after you.
Sir Simon, who revealed he himself had had coronavirus and self-isolated for just over a week, was meeting student nurses and doctors who volunteered for frontline work. Is it a bit daunting when you think about it?
Yeah, it is. It is daunting. Because obviously I have family, I have friends that I care about, and my health too as well, but it's an important time for everyone to be part of it.
Boosting testing of patients and NHS staff wanting to return to work is an urgent priority, and the government set an ambitious target of 100,000 a day by the end of this month, up from about 15,000 now. And the big pharmaceutical companies say they can help.
We'll be fully operational at the end of the month, beginning of May, and by then I think that lab's going to be contributing around 30,000 of the target. And obviously we're delighted to participate. We've got many of our scientists who are very engaged in that and keen to support that aspect of solutions.
But supplies of personal protective equipment are still tight, and there's been an urgent appeal to businesses to produce whatever they can for frontline staff to help save lives for the carers as well as the patients they look after. Huw, BBC News.
Well, one of the most troubling elements of the new data from the ONS is that around 1 in 10 of all deaths linked to coronavirus happened outside hospital, including at least 217 in care homes, and those figures are already some 11 days out of date. The charity Age UK has warned that COVID-19 is spreading in care homes like wildfire. The government says it wants to speed up reporting of deaths in care homes. It's already confirmed that there have been outbreaks of COVID-19 in more than 2,000 homes in England, as our correspondent Alex Forsyth explains now.
My mum was a people's person. She told everyone she loved them and everyone loved her.
Rose Mitchell was a familiar face on her street in southwest London.
To Rose.
So much so, her neighbours stood outside to pay their respects on hearing that she'd died. At 81, she passed away in her care home after contracting coronavirus. Her daughter and the rest of her family on the end of the phone.
They held the phone to her ear. We could hear her just breathing. And we played her Danny Boy, her favourite song. And we all told her we loved her and said goodbye.
Karen says what's happening in care homes can't be overlooked, praising carers like those who were with her mum until the end.
I can only say to them, thank you, because over the last week that has brought us incredible comfort to know that she wasn't alone.
Care homes across the country are reporting a rising number of deaths. Here in Liverpool, 15 residents. A further 13 people at this home in County Durham. And here, near Bristol, a significant number are said to have died. At Philia Lodge in Peterborough, 16 out of 18 residents have shown symptoms and 6 have lost their lives. Carers there when family can't be.
For now, Grandma, this is goodbye. But I know that you will always be with us in our hearts and that you've helped make so full of love and happy memories for us to treasure forever. Good night and sleep well.
At this home not far from Wolverhampton, staff are frightened. Impossible to keep their distance from each other, these carers say they're on the forgotten front line.
It's just scary because they said it's got to get worse. So when you keep thinking of what's the next shift going to be like, what's going to happen on this shift, and we're going to...
It's mentally and physically draining.
Yeah.
The staff are all quite worried because when we have ambulances come in, that they're all got the full-on gear on, and where we haven't got a lot of PPE, you feel vulnerable.
Yeah, and it's worrying as well, because we're going back to our loved ones as well.
The government says it is delivering millions of items of protective kit and increasing testing capacity, but managers here say it's not enough.
They're not testing. We're not testing. We've had residents come back who have been to A&E and they've come back and they're not testing them.
Do you feel like you're getting the support you need?
Not particularly,
Not really,
no.
Some residents are staying positive, even while separated from family.
Nobody knows how quick it's going to go away, and I think it's going to take a long time.
What's your plan when you finally get to see your family again?
I'll have several gin and tonics and say hooray.
Optimism, despite real concern for society's most vulnerable and those who are trying to protect them. Alex Forsyth, BBC News.